The world stands on the precipice of a potential pandemic, one far more devastating than anything we have witnessed in recent history. The culprit, avian influenza, specifically the H5N1 strain, this virus, primarily circulating among bird populations, poses a direct and imminent threat to human health. The historical data paints a grim picture. H5N1 infections in humans have resulted in a staggering 50% fatality rate. Should a human transmissible variant emerge, the consequences would be catastrophic, potentially eclipsing the devastation wrought by the COVID-19 pandemic. We are staring down the barrel of a potential 30 million deaths, with the possibility of 400 million individuals grappling with the debilitating effects of long COVID. The alarm bells are ringing louder and more urgently than ever before. We must heed these warnings and act decisively to avert a global health catastrophe. The spectre of a bird flu pandemic is no longer a distant threat. It is knocking at our doorstep. Recent developments in New York State have thrust the issue into the spotlight, underscoring the immediacy of the situation. On February 7, 2025, Governor Kathy Hochul took the decisive step of ordering the closure of live bird markets in the bustling New York City metropolitan area. This action came on the heels of alarming detections of the H5N1 virus in 7 birds, raising concerns about potential spillover into human populations. Recognizing the need for heightened surveillance, the New York State Department of Health, in conjunction with the New York City Department of Health and Mental Hygiene, issued a crucial advisory on February 3, 2025. They urged healthcare providers to expedite influenza A subtyping in hospitalized patients, a measure aimed at swiftly identifying any potential bird flu cases. This move mirrored a similar recommendation issued by the Centers for Disease Control and Prevention, CDC, on January 16, 2025, highlighting the growing national concern over the looming threat. These recent events serve as a stark reminder that we are in a race against time. The virus is on the move, and our response must be equally swift and comprehensive. The 2024 to 2025 flu season has been one for the record books, the worst the United States has seen since 2009. With a staggering 24 million illnesses, 310,000 hospitalizations and 13,000 deaths attributed to influenza, the healthcare system has been pushed to its breaking point. The situation is further exacerbated by the fact that 43 states are grappling with high or very high levels of respiratory illnesses, including not only influenza but also COVID-19 and respiratory syncytial virus, RSV. This confluence of factors creates a perfect storm for the emergence of a highly transmissible and potentially deadly bird flu variant. Co-infection with seasonal flu and bird flu heightens the risk of viral reassortment, a process by which these viruses can swap genetic material, potentially resulting in a hybrid virus capable of spreading efficiently among humans. Adding to the concern is the woefully inadequate level of bird flu testing being conducted, which may be masking the true extent of the virus's spread within both avian and human populations. This lack of visibility hampers our ability to effectively track and contain the virus, leaving us vulnerable to a potentially devastating outbreak. As the threat of a bird flu pandemic looms large, the Trump administration has embarked on a reckless and irresponsible course of action, systematically dismantling the very public health infrastructure that is crucial to protecting the nation from such a crisis. Trump's actions are not merely misguided, they are downright dangerous, putting the lives of millions of Americans at risk. One of his first acts upon assuming office was to rescind President Biden's executive orders aimed at strengthening global health security and pandemic preparedness. This included the dismantling of the National Security Council's Directorate on Global Health Security, a vital body responsible for coordinating the U.S. response to global health threats. Trump's assault on public health extends far beyond the borders of the United States. He has initiated the withdrawal of the US from the World Health Organization, WHO, a move that undermines global cooperation and coordination in the face of a potential pandemic. Furthermore, his administration has halted funding to the WHO and paused critical reviews of foreign aid programs, further weakening the global health security architecture. Section 5. Science denial in the halls of power. Trump's anti-science appointees. In a move that has sent shockwaves through the scientific and medical communities, the Trump administration has stacked key public health positions with individuals known for their anti-science views and dubious credentials. These appointments are not merely political maneuvering, they represent a clear and present danger to the health and well-being of the American people. Leading the charge in this assault on science is Robert F. Kennedy, Jr., a notorious vaccine skeptic who has been confirmed as the Secretary of Health and Human Services. Kennedy's appointment has been met with widespread condemnation from public health experts, who view his lack of scientific literacy and his history of spreading misinformation as a recipe for disaster. Adding to the chorus of unqualified individuals now in positions of power is Dr. Mehmet Oz, better known as Dr. Oz, who's been tapped to head the Centers for Medicare and Medicaid Services, or CMS. Dr. Oz, a celebrity physician with a penchant for promoting questionable medical advice, lacks the experience and expertise to effectively manage a complex and vital agency like CMS. Section 6. A shared failure. The Democratic Party's inadequate response. While the Trump administration's assault on public health is undeniable and reprehensible, the Democratic Party is not without blame. Their inaction and prior negligence have contributed to the current crisis. During the Biden administration, complacency allowed H5N1 to gain a foothold and spread within U.S. poultry farms. This failure to contain the virus has resulted in 66 confirmed human infections in the past year alone, the second highest number globally. The Democratic Party's response has been characterized by a lack of urgency and a failure to grasp the gravity of the situation. Instead of enacting bold and comprehensive measures to address the threat, they have largely resorted to incremental steps and half measures. This lack of decisive action has allowed the virus to spread unchecked, bringing us closer to the brink of a devastating pandemic. The Democratic Party must acknowledge its own shortcomings and work to regain the trust of the American people. This requires a fundamental shift in their approach to public health, one that prioritizes prevention, preparedness, and a commitment to evidence-based policymaking. Section 7, a socialist blueprint for public health. Confronting the crisis. In the face of a global health crisis of unprecedented proportions, it is imperative that we embrace a bold and transformative approach to public health. The time for incrementalism and half measures is long gone. We need a socialist public health program that prioritizes the health and well-being of all people over the profits of corporations. This program must be rooted in the principles of social justice, equity, and solidarity. A key pillar of this socialist public health program is the global renovation of indoor spaces. This means investing in high-efficiency particulate air filters and far ultraviolet C-light disinfection systems to improve indoor air quality and reduce the risk of airborne transmission of viruses. Furthermore, we need to implement a robust system of mass testing, contact tracing, and isolation to rapidly identify and contain outbreaks. This requires a significant investment in public health infrastructure, including laboratories, testing capacity, and contact tracing workforce. Section 8. The urgency of action. Time is running out. The window of opportunity to prevent a catastrophic bird flu pandemic is rapidly closing. We are in a race against time, and the stakes could not be higher. Every day that passes without decisive action brings us closer to the brink of disaster. The consequences of inaction are too dire to contemplate. We must act now with urgency and determination to avert a global health catastrophe. This is not a time for complacency or despair. We have the knowledge, the tools, and the resources to confront this crisis head-on. What we need is the political will to act. We must demand that our leaders prioritize public health over corporate profits and political expediency. The lives of millions depend on it. Section 9, towards a healthier future, the possibility of prevention. While the threat of a bird flu pandemic is real and imminent, it is not insurmountable. We have the ability to chart a different course, one that leads to a healthier and more secure future for all. By embracing a socialist public health program, we can build a more just and equitable society, one that is better prepared to face the health challenges of the 21st century. This is a defining moment for humanity. We must choose to act, not out of fear, but out of a shared commitment to our collective well-being. The time for action is now. Let us seize this opportunity to create a world where everyone has the right to health, safety, and dignity.